Welcome to this video exploring the incredible role of horseshoe crabs in the pharmaceutical industry and the development of more sustainable and ethical medical practices. Horseshoe crabs are fascinating creatures that have been around for over 450 million years, and their unique properties have been essential to the biomedical industry for over 60 years. In this video, we'll dive into the history of horseshoe crabs, their importance to coastal ecosystems, and the ongoing efforts to find sustainable alternatives to the harvesting of horseshoe crab blood. Part 1. The fascinating history of horseshoe crabs. Horseshoe crabs have been around for over 450 million years and are considered living fossils due to their ancient appearance and behavior. These fascinating creatures are not actually crabs but are more closely related to spiders and scorpions. They are an important part of coastal ecosystems and help maintain the health of these habitats. Part 2. Horseshoe crab blood and the pharmaceutical industry. The biomedical industry has relied on horseshoe crab blood for over 60 years to produce limulus amebocyte lysate, LAL, a substance that can detect bacterial endotoxins. Endotoxins can be harmful to humans and can cause infections or even death. However, the harvesting of horseshoe crabs has led to concerns about the impact on wild populations. Some estimates suggest that up to 30% of horseshoe crabs die as a result of the harvesting process, and the use of horseshoe crab blood has been called into question as a result. Horseshoe crabs are an important part of coastal ecosystems, and their populations have declined in recent years due to overharvesting and habitat loss. Part 3. The development of sustainable endotoxin testing. The Rabbit Pyrogen Test, RPT, was one of the first methods for detecting bacterial endotoxins in medical devices and pharmaceuticals. However, the use of live animals in testing has raised ethical and environmental concerns. This led to the discovery of horseshoe crab blood as a substitute for the RPT. However, the harvesting of horseshoe crabs has led to concerns about their populations and the environmental impact of the practice. Now, with the development of RFC technology, we have a promising new method for endotoxin testing that is both sustainable and effective. Part 4. Recombinant factor C, RFC, and the future of sustainable medicine. Recombinant factor C, RFC, is a promising new method for endotoxin testing that does not require the use of horseshoe crab blood or live animals. RFC is produced using genetically modified bacteria that mimic the clotting properties of horseshoe crab blood, making it a sustainable and ethical alternative to LAL. As technology improves, it is hoped that RFC will be able to replace LAL and become the new standard in endotoxin testing. This would help to reduce the harvesting of horseshoe crabs and minimize the impact on their populations and the environment. Conclusion. Horseshoe crabs are a fascinating species that play a crucial role in maintaining the health of coastal ecosystems. The unique properties of their blood have been essential to the pharmaceutical industry for over 60 years. However, the harvesting of horseshoe crabs for their blood has raised concerns about their populations and the environment. The development of RFC technology provides a sustainable and ethical alternative to LAL, which could help to reduce the harvesting of horseshoe crabs and minimize their impact on the environment. By exploring the fascinating story of horseshoe crabs and sustainable medicine, we can learn more about the delicate balance between science and conservation. Thank you for taking the time to explore the important role that horseshoe crabs play in the pharmaceutical industry and the development of sustainable medical practices.